We are a speech and language therapy team, and we work with people who are receiving assessment and treatment for their mental health needs in hospital.
Undergraduate physiotherapists will come and work with us in a number of different clinical settings.
Our placement structure is set over an A placement, a B placement and a C placement, and all of our students will have one of those substantive placements in the NHS and one in a role emergent or non-NHS setting.
We are offering for the first time a project placement.
Doing this placement will really help with my continuing personal and professional development in the future, and it will really contribute towards my evidence-based practice.
It will allow them to develop their research skills, their data analysis skills, and be able to apply the information that they will be looking at in a clinical setting.
I think it's a first in my uni that I know of to do a mental health placement, so I feel really privileged and excited.
Speech and language therapy is a relatively new profession. It's a profession which is developing across the country. So we work really closely with physiotherapy, with occupational therapy and dietitians.
Dietetics can often be an underrepresented group in the allied health profession group, but it's absolutely imperative for anyone, every single one of us, particularly when we think about in the context of mental health and learning disability services.
My placement was in a community mental health setting for adults, and then getting that experience of working sort of one-to-one, that was great, and having a little room where I had all my materials and that space, and I really began to feel quite established there.
I'm a second year Masters in Dietetics student at Teesside University, and the placement that I went on for my second placement in the course was a role emerging placement, which means that it is not a traditional NHS setting. It was based at a residential service for people with learning disabilities. What that placement really taught me was the need for dietitians to be involved more, because particularly for people with learning disabilities, they might take longer to learn information, they might need the way that it's being delivered to them adapting, and in a clinical setting that can be quite difficult to deliver.
I think some of the key benefits of those non-NHS role emerging placements is the breadth and the diversity of learning that our students experience. It's absolutely blown me away this year when they've come back from their placements and shared some of the projects that they've been involved in.
While I was at university, I had an 8-week peer placement within speech and language therapy in mental health inpatient. At first I was very apprehensive, very nervous, so I'd never heard of what speech and language therapists do in mental health because it's quite a new role.
Once they're here and they see the work that we do and they get to know the patients and their stories and work with them and their families, we're diminishing that stigma, and people come away with a really good experience and take that forward into their career.
This mental health placement has definitely enriched my life and my outlook on life.
We tried to create a learning opportunity to work collaboratively on a project that's going to be insightful for them clinically, but will also provide the trust with some really useful analysis of data.
I'm just happy that in my career that I've chosen as a physiotherapist, we also can contribute and help people.
When we first went to the placement, we were quite worried about how we were going to get the residents involved, how we were going to kind of get them on board with the work that we were doing. It was really, really nice, after being worried about getting everybody engaged at the start, to see them really excited and quite proud of the work that they've put into the projects that we did.
So coming into a team of art therapists, I really had that support, and everyone on the team were so diverse and brought something different, and I really felt like I could add to that, and they sort of allowed me to flourish in that sense.
When we have students on placement with us, they bring a real energy to our workforce.
I personally found that a lot of the service users wanted to educate me and get to know me, and vice versa.
A lot of people in recovery came to a point in their lives where I think they forgot how to be vulnerable and to play. So I learned quite quickly that it was a lot about making people feel safe to use the art materials.
The biggest significant moment was working with one individual. He didn't really engage with staff a lot, so I went round to do some therapy with him, knocked on his door. He didn't want to see anyone, but then when I said, "Oh, it's Beth from speech and language therapy," all I heard was, "Give me 5 minutes." And then he could hear him getting ready, and then he came out and he said, "Yeah, like, where are we going? Where do you want to do therapy?"
So one of the things that students have been able to bring for us is demonstrating what increased provision can provide to patients and their families and staff.
So I went into my placement not knowing what a speech and language therapist's role is within mental health.
And what we've been able to do is recruit those students into posts, which means we've been able to develop the service.
And then I took away from that placement that actually this is where I want my career to be, and ended up getting a job in mental health.
Students are really quick thinkers. They bring a different perspective into patient care.
And although you might have some expectations and some thoughts about what you think it's going to be like, actually the chances are it will be completely different.
Of all of the students that I've looked after so far, or that I've come into contact with so far, their appreciation of working in mental health after completing their placement has shifted, and many of them expressed an interest in wanting to work in mental health when they qualify.
In a time of great pressure in the NHS, it's really important we have students on placement with us so we can develop our workforce for the future.
I found that this placement has really helped my personal development, so working with such a varied case of people, learning so much more about people's lives, people's backgrounds and how that impacts them to this day, and really being a part of that journey to recovery.
I know now that I can go onto a placement and I can problem solve, or in the future if I'm in the NHS and I see maybe a service improvement that I think might need implementing, whereas before I would have held back. I think now I have the confidence to be like, actually, yeah, let's give this a try, because I've done that now and I've seen that it can work.
Giving students the opportunity to experience working in an acute mental health trust will enable them to look at patients differently.
Not only do you learn the patient care side, such as through doing clinical assessments and treatments, but also you learn about the importance of taking into account mental health when treating patients.
It's a very flourishing and vibrant team, and I know I will grow here.